finally, a source of raw, real, and honest information on healthcare issues that matter most. Welcome to BS Free MD. From the latest medical information to how to stay sane as a doctor or a patient, no subject is taboo, no BS is allowed. Now, let's welcome your hosts, Doctors May and Tim Hindmarsh.
Hey everybody, so happy to have you back this week with us, and we hope you had a great weekend. Wasn't it Easter last week? Are we already there in our recordings? I can't remember. Anyway, we are super excited to have with us this week Dr. Robert Yoho, who has an amazing book called Hormone Secrets, and I know you've all been asking for a long time to do a show on hormones, etc. So here it is. Hang on to your seats because this is going to be fun.
All right. So we are back with an episode that we know a lot of our listeners have been looking forward to. We are going to talk again to Dr. Robert Yoho. So great, they named a Canadian national park after him. It's true, Yoho National Park.
There you go.
But he wrote another book, Not Just Butchered by Healthcare, which we discussed last time, but Hormone Secrets. May and I have gone through the book. It is very enlightening, to say the least. We're going to talk about male, but most importantly, female hormone replacement. There's a tremendous amount of confusion out there, both on the doctor and patient side, as far as safety, appropriate dosages, et cetera, et cetera. So once again, Dr. Yoho, thank you for joining us today.
Thanks so much, guys. I really appreciate being on and, getting another look at your lovely wife. Did I say that?
Yeah, that's right.
There you go.
This is just audio, but we can see each other.
We can. Now, I'm super excited because we've been bugged by lots of people, as well as our own personal interests have been peaking in hormones, not just throughout our career, but also as we get older and get past the 50s and things seem to dwindle. We want to maximize our health and how great we feel. So
speak for yourself, oh dwindler.
There you go. So, yes, I've been, a lot of the things that I've been reading through in your book are things that I kind of thought myself when I was doing family practice. But now, I guess now that I'm kind of the patient as well as advising patients and friends, I'm just blown away with how there's such a dichotomy, it seems, in what, we have like the hormone replacement clinics out there with the people using bioidentical hormones. And then there's the traditional school of thought with, traditional medicine, endocrinology saying, yeah, no, hormones bad. You can't push somebody on their doses of thyroid or even their estrogen, testosterone, etc. So first, before we get into each specific hormone and or gender, what about why is there such a dichotomy in school of thought between traditional medicine and then this other part where people are not afraid to go beyond what the studies are out there? Any thoughts on that?
Oh yeah, you're seeing exactly the same thing you're seeing with the virus narrative and the international narrative and all that stuff. There's a wall of propaganda which is put forth by industry, which predates the whole COVID thing. And basically, it was used to discredit bioidentical hormones, which cannot be patented, and they can't get these outsized amounts of money from. And so, I mean, you know about the Women's Health Initiative. That was a study that was published 2002, and it was possibly the largest study in history. It was a $1 billion study, roughly. And they claim to have found an increase in breast cancer for patients taking both Premarin, which is horse urine estrogen, which is patented at the time, I think, and Provera, a patented synthetic progesterone. And it produced an enormous scare. And it seems that the authors had an agenda to discredit hormones and to take them out of our formulary. And what happened was all these chicken primary care doctors and gynecologists, they took all their patients off of hormones, which, I mean, it destroyed the health of a generation of women. And it was basically studying drugs that are obsolete at the time that the study was complete. The statisticians sensationalized the whole thing, and the whole thing has been completely discredited since then. But once a bell is rung, it can't be unrung, and we're still hearing all this propaganda about estrogen causing breast cancer. Well, the World Health Organization, or whatever it is, the WHI, the Women's Health
WHO
Initiative.
or what WHI? Yes, sorry,
the
I'm getting
WHI.
them mixed up too.
The WHI never proved that estrogen was a problem at all. Even the horse urine estrogen, the Premarin, they only found a small statistical anomaly with the synthetic progesterone, which is Provera, and that had a very small effect on breast cancer. But I don't even memorize the exact amount, but it's microscopic. But so hormones are branded with cancer, dementia, and all kinds of other problems. And the reviewers that followed this up just make these people look like monkeys. But they still had the biggest stage. And when you have $1 billion to spend on a study, you've got plenty to hype a bunch of nonsense. So,
but it
so
seems like it's stuck.
Yeah.
Because it seems like it's stuck, because even if you look up now, if you just kind of Google information on hormone replacement, postmenopausal, for instance, hormone replacement in women, estrogen, progesterone, they still say, we'll use it for the smallest duration possible and the smallest dose possible, and get off of it within 10 years of using it. So it's like you're supposed to take it for your symptoms, but then quit right away.
These unpatentable drugs that are relatively inexpensive, they would replace many patent drugs, including statins and heart disease drugs and a lot of other stuff that would prevent all that. So this is it's been a wall of propaganda. And you mentioned Google. Google is the mendacity behind Google is beyond belief. I mean, if you want to listen to a podcast about that, look at Robert Epstein's podcast on Joe Rogan, and you can find out what Google's up to. Google changes the search results to match whatever their paymasters tell them to do. And these huge companies are all owned in common by a few large entities. In the United States, it's BlackRock and Vanguard have $25 trillion in assets. And they are BlackRock is a majority owner of Pfizer and Moderna. And I don't know exactly what their shares of Google are, but we're facing a monolithic censor that is basically has no interest in our health. They have a drug, the Vax, which is not the most profitable drug in history. It's the most profitable product in history. It's bigger than the iPhone year over year. It's bigger than Coca-Cola. I mean, it's just incredible. And Pfizer's profit margins have been 40 to 50% the last 5 years. I don't know what they are this year. Probably 70%. I mean, it's just crazy. And you can only get a profit margin that high if you're doing something funny. And an ordinary profit margin of 10% is anyway. Sorry about that rant. Back to the case at hand. How do you want to pursue this hormone podcast?
Well, so why don't we just dive in hormone topic by hormone? So for instance,
let me paint you a scenario. So, you have your,
I was going to say, why don't we just take it one by one?
estrogen,
progesterone, testosterone, melatonin, and thyroid.
So hormone replacement in women. What age do you start? How do you ramp up doses? What hormones should they be on? What benefits should they be looking to as far as titration and so forth?
Okay, so the standard disclaimer is this is not medical advice.
Right.
Use this information at your own risk. And the last thing is, if you have a problem, you have to see somebody who is currently practicing and licensed like you guys. So I can read a couple of testimonials, which I always do at the beginning of these hormone podcasts. So what's that?
Oh, yeah, I was going to say, and just to clarify for our audience, if we didn't already, that, I mean, your expertise in this is that you've been studying hormones, using bioidentical hormones and prescribing them to your patient practice. I think on our last episode, you mentioned how you got started because people were coming to you and you were doing the cosmetic procedures. And
Right.
then you're like, hey, people are feeling like crap. What's
So
going on with their hormones?
most plastic surgeons treat hormone problems with surgery, which is inappropriate, And
Right.
I saw these women, and I'm not in the pockets of a insurance company, or I don't have requirements to prescribe a certain number of statin drugs or anything else. So I saw the problem pretty clearly, and I trained and I learned about hormone therapy, and I ultimately certified with World Link Medical. And I started offering these things to my patients just as an adjunct to my cosmetic surgery. And by the time I quit, I was 65. Most of my patients they were, you know, they were women, obviously, because it was cosmetic surgery, 95% plus women. And the standard joke about cosmetic surgery is, what's the big problem with cosmetic surgery? There's only one problem, really. The
You get a
women.
bad
The women.
surgeon.
And it's all women.
Boo.
And it's all women.
Get a
I'm
bad
sorry,
surgeon.
Becky. I'm sorry. That's a bad joke. It's kind of true, though.
Well,
But anyway.
actually, you're right. I mean, women are very picky, demanding, and I can't imagine when they're hunting for perfection and they turn to a plastic surgeon. You just can't win, can you? I mean,
well, you try. And I had
Yeah.
a wonderful wife who kept on top of it for me and tried to handle the personalities that I was incapable of handling. But anyway, so really, it's true. So what I did was I used a simple hormone pellet that I helped my women with if they were interested and they decided to, become educated about it and they consented. I would stick a pellet in their belly button, which doesn't scar. It's from the inside of the belly button, through a little large needle during the surgery. And I tell you, I did a lot of cosmetic surgery. I got a lot of great results. But the results I got with bioidentical hormones were profound. And these women had come back in a couple of weeks and they say, I haven't felt like this for 25 years. I feel great. And I just use testosterone, which can be used as a single agent and is commonly inserted as a pellet. It works pretty well for 2.5 to 3 months. And then, of course, they have to come back and get another pellet. And so they'd pay me a little something at that point, but the first pellet was a freebie. So here's a couple of quotes. Janet, we generally prescribe bioidentical hormones from roughly the age of 50 onward. I have seen women in their late 30s who were fully menopausal, and they needed hormones in. They'd had their kids, and they were miserable. They had hot flashes. They were irritable. They were disintegrating. So here's Janice, 51 years old. My marriage was disintegrating. I hated everyone around me and I felt terrible. But I got on the hormones and they saved me. I'm trying to repair all the damage I did. So, I mean, these women are the precious glue that hold us all together. I mean, their proper functioning and positive feelings are everyone's bedrock. And my wife believes that menopause is the most common cause of divorce for couples over 45. Female menopause. She's interviewed thousands of you guys, and that's her opinion.
That and yeah, I mean, between financial issues as well as, I mean, obviously differences in sex drive, affection, all that. I mean, that's a huge issue and nobody wants to really talk about it.
So your sex drive is sort of okay when the kids are little because you're younger, and then but you have no time because of kids. And then you go through menopause, the kids leave, you have all this time. If you've planned appropriately, you have a little bit more disposable income. And then she has no hormones, so now it's she bitch from hell.
Well, I think there's
that's a mean thing to say, Tim.
I'm not speaking of personal experience.
I am gonna call bullshit on that. There's a lot of menopause. There's a lot of menopause. Just like a man cold. There's a lot of menopause that goes on too. So it's a two-sided street.
Oh no, there absolutely is, man. When the dog don't want to hunt anymore, the dog just sits around and watches a lot of ESPN. I understand it.
I mean, we can get into that in a bit, but for sure, if there's an imbalance between sex drive, but in the husband and wife, between partners. I mean, that's huge issues because that's a big, obviously, love language of men. Sometimes it's a women's primary love language is sex, and so we'll kind of get into how you kind of balance both partners, I guess. But so when you're saying that women would come into you, you're doing the procedure, and the common complaint drove you to believe that testosterone, is that right, was going to be helpful for them?
Well, they had hormonal deficiency issues, and when I tested their hormones, they were freaking all zero. And
Okay,
these are women in their 50s. Women fall off a hormonal cliff where men gradually get the dwindles.
right.
From 30 years on, they drop 1% in their testosterone every year, and roughly. Um, but uh,
So,
go ahead.
oh, I was going to say, so 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 once we get to menopause, I mean, pretty much hormones prior to menopause in females, it's definitely a balance of estrogen, progesterone. A lot of women are on birth control pill replacement, so it's always like I always call it very fine cooking to try to get the right balance, just based on their symptoms and what their periods are doing. But after menopause, everything just kind of, you're right, falls off a cliff and drops. Period. So let's say someone comes in, there's a lot of pushback to give women hormone replacement because, everyone wants to take the natural approach, doing the vitamin E and the black cohosh and the primrose oil to minimize symptoms. Of course, the SSRIs, which is antidepressants, the Effexor for the hot flash part.
Right. So if your sex drive was 0
Mm-hmm.
and then you're on SSRIs, now
Yeah,
it's 40
in the
below
negative.
0.
Exactly. So I guess I don't know. I mean, I probably should answer this question better than you, as far as like, why don't primary care docs, gynecologists want to just do hormone replacement in women as they're going through menopause and postmenopause right away, instead of trying to, I mean, I tried to Band-Aid myself. I learned the hard lesson. I think it was God telling me. I used to see patients in the office, and I'd be in my early 30s in my career, and these women would come in and they were griping and complaining with their hot flashes and going off, and I thought, suck it up, buttercup. I mean, you're not very tough. I'm like this tough athlete, like the injured pain, and I'm like, they're just like wimpy. It can't be that bad until, oh, it happened to me, and I had like I think the worst cases of menopause. I mean, waking up at night drenched in sweat and every hour. I'm at work. I mean, 30 minutes on the regular on the clock where my clothes are wet. I can't focus. And now I'm like sleep deprived and bitchy and no sex drive. And I just feel awful. And I have the other thing, no motivation. I mean, I'm an athletic person. In the morning, I don't want to do anything. I have no desire to do things I'm interested in, sports, hobbies. I mean, this is a common complaint. And so I tried the black cohosh. I'm already on an SSRI. I added the primrose. I took all the, Mary Lou Retton's concoction, all of it. And it might have helped a tiny little bit. But then I said, this is ridiculous. So I started, researching more. I'm like, why am I afraid of hormones? Because it got drilled into my head too about the potential risks. And then I have to take both because I still have a uterus. So for those listening, if you just take estrogen by itself, it can increase your risk for endometrial or uterine cancer because you need the protective benefit of the progesterone. So I'm like, now I'm going to have to take two things. And all that I had learned and had been taught by the establishment and what I kind of looked up was that it was more harmful. But then I'm like, what about all these benefits? So then I started researching it some more. And I guess that's where I want you to sort of help out, is that really the benefit of quality of life to risk ratio is like inordinate. And that's what you've seen. That's what your research has shown and what you've found in treating women, right? Now that I'm on my patch and my progesterone, like I've got my life back.
Okay, so your risks of, besides just this violent hormonal withdrawal and severe hot flashes, your risks are no sexual interest, stroke, fractures, heart disease, memory loss, eye deterioration, and risks of death increase. So the replacement is critical, and you mustn't be afraid of these compounds, which are um, bioidentical. They're the same as your body's components. even the old ones are much better than nothing, but they're inferior compared to these cheap bioidentical hormones. So you've sort of gotten yourself red pilled, but I'm going to tell you about my philosophy about trying to educate women. And that is, I never try to persuade anyone to start therapy because leading this horse to water is all I can do. If I argue with them about whether they're thirsty or not, it's like arguing with a German. You can't do
Yes.
it. You're going to get, now look, I get a pass on that because I'm German. Okay.
Yeah,
Exactly. I love it.
So you can't convince, yeah. You can't convince anyone that the wall of propaganda that they've heard is completely fraudulent. And that's what I want to say is these drugs, they're the oldest drugs we've had practically. Thyroid we've used for 120 years. Estrogen, progesterone, testosterone, 50, 60, 70 years of experience, and even growth hormone, 50 years of experience. I mean, these are wonderful drugs. They're practically without side effects. You mentioned the only caveat, which is that if you have a uterus and you take estrogen alone, you can increase your chances of uterine cancer. But if you take progesterone in addition, your chance of uterine cancer drops to below taking nothing. So, I'm happy you found your way through the forest to this and are interested. And my little book about hormone secrets it's like a little textbook with all the doses and all the levels and all the advice. And the biggest problem about hormone administration is not taking enough. I mean,
Yeah.
as we mentioned before
Right.
we went on, the crazy bodybuilders take 20 times. They start out at 10 to 20 times the physiologic dose of testosterone, 10 to 20 cc's IM, which is a lot of freaking shots in 1 week, right? That's per week. And these guys don't have any problems. I mean, I say that for emphasis. Maybe they have a few problems, but maybe they get some pimples or balls shrink and they grow some hair or lose some hair on the top of their head. But I mean, it's not much of a health problem. And so the big problem with hormones is not getting enough and thinking that this advice to not take hormones that is offered up by big pharma so they can sell absolute garbage like Prozac is thinking that makes any sense at all. And I don't know whether we discussed this, but it's my opinion based on a lot of reading that psychiatry and the psych drugs are the most corrupt area in medicine, most expensive, most corrupt. And if you've taken Prozac for 2 years, you're freaking stuck on Prozac. It's going to be very hard to stop. You're going to have waves of anxiety and depression that you wouldn't have had to begin with. You were treating a problem in the case of depression that waxes and wanes and is traditionally thought to be time limited with a drug that renders it chronic. And I mean, it's a horrible story. We can chat all day about that. But I hate to even think about what we've done to a generation of
Right.
people
Right.
by giving them psych drugs. We've got almost 20% of the populace on psych drugs, and I mean the SSRIs predisposed to violence and suicide. The atypical antipsychotics cut the lifespan by 10 to 20 years. The amphetamines probably shrink your brain, at least according to animal models. Everybody thinks we're using too much of that nonsense. And the benzos are addictive, even though they are the most benign of the psych drugs. The Xanax type drugs. They're not. They're bad. They're bad news.
So what
So
about, have you, when you were treating patients for menopausal symptoms with the hormone, do you ever have to add anything supplemental to it, or could you get the dose? So I'm thinking, we used to use clonidine or catapress patch, usually more than orally, for some women with severe vasomotor hot flashes. Did you ever have to adjunct that, or could you get the dose right using enough estrogen, progesterone?
May, that stuff is nonsense.
Okay.
And if you have problems that persist, you're using a dose is too low,
Too low.
generally
All
speaking.
right.
And you can
So,
easily conquer hot flashes with progesterone and estrogen. You just have to use enough. And young women have estradiol levels that are in the hundreds during certain parts of their cycle. Don't be afraid of using more estradiol. You start at 2.5 milligrams and you can go up from there. It's not a big deal. And the progesterone, nobody's ever thrown a rock at progesterone and said it does anything bad. I mean, it's
no.
perfectly harmless. And I had women that were very aggro. I used another word in our pre-conversation, but they were aggro. And
she bitch
we
from
used,
hell.
I used up to 800 milligrams of, or more, 1,000 milligrams of long-acting progesterone, micronized at bedtime, or they can take the troches. They suck on those like pacifiers during the day. It doesn't make them sleepy, and they take it allows them to sleep for the first time in years.
So I noticed that you also mentioned giving progesterone to women who, even though they've had a surgical hysterectomy, it's still effective to use for some things.
Yeah.
And so that's been the other thing that, in traditional medicine, it's like you've had a hysterectomy, you never need progesterone again because we don't have to protect your uterus. But we haven't been taught to think about what progesterone does and
Okay. So
why it should be available. So go into that a little bit more. The uses of
this
progesterone.
is now, if you look, I hate to say this, but I'm going to say something that's not PC again. What if you had to pick the dumbest medical specialties with the least intellect? Who would you pick? Okay, we'll just leave that one hanging in the air. But there's an absurd narrative that the gynecologists have come up with, right? And that is that if you cut a uterus out, there's not going to be any more uterine cancer, right? So I mean, how much intellect does it take to figure that one out? And so they see the world in a single dimension, and that is uterine cancer. Well, I mean, you can't deny progesterone's benefits to the full third of U.S. women over 50 who've had their uteruses removed. I mean, and that statistic that you may understand, that's crazy too. It's just as crazy as the C-section rate, which is about a third too, when the sweet spot for mortality is 15%. I mean, these guys are aggressive surgeons. They have to make their money. And, I mean, I don't know. I'd probably cut uteruses out too, more than I had to if I was in their shoes. And that was my only hat trick, my only trick for making money. So,
yeah,
I mean, there are industry narratives for each one of these hormones. And
but it's super fascinating because it brings up 2 points, which is, why would you have this hormone? Why would it be a hormone? In other words, a chemical messenger that goes through your entire body if it only has one end organ it works on. It would be a microhormone. It would be a neurotransmitter. It would be the nervous system. It wouldn't be this hormone that you produce to go through your whole body. It obviously has effects on your whole body, or else it doesn't need to be a hormone, just teleologically. The second thing is, everyone that is not a generalist in medicine gets blinders. And like what I've said about cardiology is they look at these studies of Plavix on, decreasing stent occlusion rates and, how long a reperfusion lasts. And the good data is out to about 6 months, but everyone stays on all these anticoagulants or antiplatelet agents forever. And I'm like, okay, so then the 85-year-old woman comes in that needs 2 hips. She's in a walker and she's on an antiplatelet agent and an anticoagulant at the same time. And I'm like, well, her risk of death is massive. If she falls down, she's going to bleed out of every pore. But it's like, if you're the cardiologist and they don't die of a heart attack, you still win. And this sort of big picture of, you do hormone replacement for a whole bunch of reasons. You do it for dementia. You do it for heart disease risk. You do it for physical well-being. You do it for mental health. You do it for all of these things, which makes perfect sense. But we get into the word I hate the most, silos. And then if it's outside of my little Venn diagram silo, then it must be wrong. Or I just it just never ceases to drive me nuts.
Okay, so if you want to run down the cardiologists, I've got a whole bunch of material about angioplasty in general. I mean, angioplasty arguably is a completely worthless procedure that doesn't do anyone any good, right? And you can read about that in Butchered by Healthcare.
Right.
But we don't have to get into that. This is a hormone.
No, I know that I can just hear my women listeners chomping at the bit. Like, okay.
Let's talk about how.
So what would you do? You've got your recommendations for someone who's postmenopausal, feeling crumbly, uterus or non-uterus. What would you? I mean, I know it's on levels and symptoms. Yeah.
Let me back up for a second, May, and let me just run over briefly what the Food and Drug Administration has done with all these hormones and why we don't use them. There are separate stories. right? So estrogen and progesterone, they smeared those with a black box warning in 2003. They claimed it increased the chance of stroke, blood clots, breast cancer, and heart disease. And they based these claims on the hazards of the industry's own patented chemicals and not the bioidenticals. It's not much of a problem anyway. Testosterone, same thing, put a black box warning on that. Reviewers all refuted that. I've got references in Hormone Secrets. Thyroid is quite a story, and it's more complicated than the other hormones. But basically, we've had this pork thyroid, which has been prescribed since the 1800s, and they developed a T4, which is half of the pork thyroid. Pork thyroid has T3 and T4, which are two components of thyroid, and the T3 is stronger and more important. But they patented T4, and pharma gave the Endocrine Society millions of dollars every year to recite the party line that T4 is better and T4 converts adequately to T3, which often isn't the case. Growth hormone was rumored to cause cancer by the FDA in 2020 and other people. And we have a study of 6,800 patients that refuted that. And they've done regulations that made the medication almost impossible to prescribe and possibly illegal, and it's almost unobtainable. So it's probably the safest and the best hormone overall. It's an unbelievable. It should be as cheap as generic insulin. And progesterone, we talked about how the gynecologist seems to have invented this smart story that when you cut an organ out, there's no more cancer. Well, yeah, that's right, but it's not the whole picture, as Tim has given a good example of. And insulin, nobody ever pretended that the most indispensable drug in history was harmful, but the proprietary manufacturing has run these prices to the sky. We got rid of the pork or whatever beef insulin, and people are rationing the expensive insulin sometimes, and they're dying because of that. And vitamin D, they raised the units to international units instead of milligrams, and it made these doses seem frighteningly high. So nobody cares about the patients, the drug manufacturers, the doctors, the FDA, and the media. All they want to do is hype up the whole thing. So anyway, so you want me to explain how when somebody goes on these hormones, how they do and what I'd recommend. Is that correct?
Yeah. Because we have half of our listeners, or if not more, are non-medical, and so I know that they're thinking, okay, which hormone's going to benefit me, and sort of what should I be looking for?
So, as I said, you can use testosterone as sole replacement for women because it gets broken down to estrogen, and they feel pretty good. I'd say they get 65% of the benefits of using all the hormones together. But when women enter menopause and when men go through their change, hormone levels drop, and some of them, their ovaries are completely inactive. You get the same effect when you do a total hysterectomy, and sometimes these poor girls are in their 30s. They get a total hysterectomy and they crash into this horrible menopause. They should all be replaced because they'll get osteoporosis, they'll get dementia, they'll get all kinds of problems. And so I recommend, testosterone, and that the cheapest way, if people really have no money at all, you can prescribe testosterone cypionate in oil, and that costs, for a woman's dose, it costs about $130 a year, like a couple dollars a week. For a man's dose, it's $10 a week for the cypionate, right? Plus the doctor time. And but as testosterone cream is excellent for women, and using a larger dose, like 50 milligrams per cc from a compounder like Anazao, is very helpful. Women can use a small amount 3 times a week, and they'll get enough. And the stuff lasts longer in women for some reason than men. Men have to inject themselves at larger doses or use the cream in high concentrations twice a day. Otherwise, their levels aren't high enough. And I've got suggested levels in my book, which you can reference. So
I like what you said in your book, how, if you're on a desert island and you can only have one hormone with you, take testosterone. Because what you're saying, it covers a lot, and it gets broken down to estrogen. So for women, they're thinking testosterone shots. So there's multiple options. If you can find someone that does the pellet injections.
I prefer to call it tiger sauce.
Yes. You can have the pellets. There is injectable, which it's common in men, but not so much in women, to do weekly or biweekly injections of testosterone, right? Just because the dose is so low. that who wants to
Women do very
stick
well on the cream.
themselves with a needle twice a week for the amount. And so the cream is the other option, as well as, what are you very fond of, the sublingual troches, however we
For
pronounce them?
progesterone, yes. For testosterone, it doesn't work. Now, you may have some little old lady that just needs a very tiny dose of testosterone, and you can even give them testosterone pills, and
Hmm.
enough gets through so it makes a difference. But
Okay.
I mean, and
So
estrogen,
starting point is testosterone, basically, kind of as a
if
blanket
if you're
statement.
if you're if you're running a clinic and you want to make money, you can use testosterone pellets. But I used to use testosterone pellets just to convince them that it worked, because you guys probably know this, but about 50% or a third of the medications prescribed are thrown away,
Oh yeah.
right? And
Right,
that's
right.
even for kidney transplant, anti-rejection method. They just freaking trash it. So if you give them a pellet in their belly button, they've got a little trial of therapy that
Hmm.
they, I mean, you'd have to take it out by a surgical procedure. So they feel better, and they generally understand what the menopausal therapy can do for them. But for the people that have the resources, I heavily recommend that they use estrogen. For the women, use estrogen, progesterone, testosterone, vitamin D, DHEA, and there are some other ones too that I don't have as much experience with. But the critical ones are estrogen and progesterone and testosterone.
Now, of course, women are all afraid of the side effects of testosterone, including hair growth, acne,
Acne,
but they think
yeah.
they're all going to grow a beard. So obviously, you have to have your doses titrated appropriately to the limit, correct? And just
I've got a friend that cares more about his hair than he cares about his longevity. And so, I mean, you can have your priorities, but a little acne, a little hair growth, a little depilatation, or laser hair removal, it's not that big a deal. And I think higher doses are almost always more successful than lower doses. And these things are terrifically, terrifically well known. As Tim said, we have knowledge about the way hormones work that dates back 50 years, and we know how it all goes around in the body. And I mean, they've all joined a propaganda parade to run all this stuff down, and it's an outrage, really. And my work is not original; it's all derivative. There's 500 references in that book, and if you buy the $3 ebook, you can click right through to the references, and you can believe it.
So take us through briefly then estrogen, progesterone supplementation, postmenopausal. You'd recommend staying on that and continuing that lifelong, right? No need to quit after 5 years, 10 years,
Well, there
as
there
the
is this
recommendations
yeah,
are, in our
there's this idiocy.
journals.
Yeah, I know. There's this idiocy that's gone around about women who start the estrogen past a year or two past menopause, right? And in theory, they have a higher probability of, cardiac events. But the craziness about that is it only lasts for about a year, and their overall net benefit compared to not taking it is profound. And so I don't know how anyone can ever
And
bring that up and with a serious straight face and say that it's a bad idea to take hormones for any
I
woman.
think the other one is coagulation, that,
I know.
for the first few months on any hormone, whether it's birth control pill or hormone replacement, you're more hypercoagulable. I think it's for the first 6 months. But you're
Right.
right. You have to look at the risk versus benefit. And what people aren't hearing is the benefits, as far as not just feeling better, but the decrease in Alzheimer's risk, the lifelong building of or prevention of osteoporosis, which is like a huge cause of morbidity and mortality in people. I
Hip
mean, you fall
fractures.
down and
Right.
break
Half
a
of them
hip,
die. Yeah.
yeah.
Half of them die
So,
within a year after hip
um,
Well, and the decreased homicide risk as well.
fracture.
as well as, I mean, simple things like macular degeneration and eye health is actually protected. Isn't that right? With hormone replacement.
Yeah.
Yeah.
Let me tell you.
So,
Go ahead.
oh,
No, I'm just trying to.
so
I'm just like intuitive. I'm a big picture person. That's why I'm a generalist. But like, it always just ceases to amaze me how you have these hormones, blasting through your body at probably optimal levels when you're 25 years old, right? And you don't have massive outbreaks of prostate cancer and all of these things. Like, I understand other things happen as you age and your arteries harden and all of this kind of stuff, but like, why would it be bad as you age and things break down? Like, the whole point of aging is things are breaking down. So if there's something that you can do that's relatively inexpensive, that does not have obvious detrimental effects, why would that be bad? Like, why would it be bad to be 60 and have similar hormone levels to a 25-year-old? Like, I don't understand how that somehow magically creates risk. Like, it just doesn't.
Because
Like,
the flames getting too close to the the gas. I don't know.
No, I mean, it just seems like silly. I mean, it's not
Right.
It's not pediatrics. It's not, aging is not like you're going back to being a child, where obviously if a child has not gone through puberty and you give them agents at the, incorrect time, then you stunt their growth, or, you stunt their cognitive development, et cetera, et cetera, et cetera. In other words, Adderall, but that's another story. So, you sit there and you go, like, why, as an adult person, as you age and things naturally drop off, with maintaining levels that are, more physiologically robust, how could that possibly be a bad thing?
Okay, so Tim, those are mechanistic arguments, and I don't do mechanisms. I do empiricism. Okay, so empiricism is uh, case reports at the lowest level, observational studies the next way up, and then double-blind controlled, placebo-controlled trials. That in theory are done properly. Now, of course, we know that pharma fakes all their studies now, and they corrupt their research subcontractors. So you can't trust big pharma with any of that stuff anymore. But no, I agree. I've got 2 points for May, one about Alzheimer's and one about her patch. Which one do you want to hear first?
Touch on the Alzheimer's first, before I
Okay, so
forget.
here,
Sorry.
she's good, Tim.
Yeah.
I tell you, I
You-
think if I lived next door, I'd be hitting on her.
Hey, I laugh at your jokes all the time. Throw me a bone, man.
I know.
Okay,
I've been trying to throw you a bone, but your
Yeah.
testosterone level's a little too
Yeah.
low. So
Go ahead, Robert.
so your listeners are going to think I'm crazy, but listen to this story. If we put all women over 50 on estradiol and they stayed on it, the Alzheimer's percentage would drop by 85%. Now, Alzheimer's, I'm sure you're well aware, is the most expensive disease in America if you count long-term care costs.
Right.
And so the reason why I can say that is I have an appendix in Hormone Secrets that has 75 references that demonstrate that, right? Now, I'm not saying that it's absolutely proven, but there's certainly a big effect. And that percentage I mentioned might be grossly exaggerated, but it certainly decreases your Alzheimer's percentage.
Yeah. I mean,
Okay,
that's
so
huge. That's huge.
estrogen, go ahead.
No, I was going to say, yeah.
Get back to the patch.
Yes. So, yes, differentiate for us, the people that don't know, difference between taking a pill, patch. Those are the main hormone replacements. I mean, the topical vaginal estrogen cream, I think most people would know that it works just locally for vaginal dryness. It's not going to do much for the systemic symptoms. So what are your thoughts on patch versus pill?
Okay, so the patch, okay, estrogen, first of all, is the cardiac drug that actually reverses coronary disease. It's very helpful. It's why women don't get heart attacks. It's thought to be why women don't get heart attacks the way men do at 50, 60, right? So the problem with the patch is it has been clearly shown to not have a cardiac effect, right? The oral estrogen does have a cardiac effect. Now, in my circles, topical progesterone and estrogen are thought to be failures, right? You don't get levels high enough for long enough. Now we got these people like Suzanne Summers.
Yes, Suzanne Summers used to be on TV all the time promoting.
And is paid probably by this other group, which is owned by a non-physician woman. What is the name of that? Wiley Group, Wiley Protocol.
Okay, I don't know.
You know that?
No.
So they are topical, everything. And
Right.
unfortunately, while you get relief of symptoms with your patch, your estradiol patch, it doesn't help improve the chance of heart disease. So here's what I would, and a lot of people like that patch because they get nice continuous levels and they feel pretty good. So here's what, if I was still in practice, what I would advise someone like you. And that is take your orals on top of that. You're never going to get so much that you're at the levels that you were when you were 21. You had levels at 300 or 400 at some point in the cycle, you know. But take your oral regularly every day and use your patch too. And that's what my wife does.
So why would you do that? Why wouldn't you just then take the oral, and why would you need
If
both?
you, but you like the patch. See, this is
Yeah,
part of my
but
thing of
I'm
never arguing with Germans.
that's funny. No, but most
So
people
it's
is like
whatever you want, dear.
it's like less. I mean, more stuff. It doesn't make it easier. It's more complicated. So if I only have to, remembering to put a patch on twice a week, it's like sometimes people forget because it's not consistent. So it would be easier just to take a pill, I think, consistently every day. Um, so you don't have to do both. Is my point to people that are listening. You can do
Exactly.
just the oral. Yes, right.
And you need to take enough, you know, and the starting dose is probably 2.5 milligrams. They get too much bloating and all that. Take more progesterone. Don't give up on the estrogen. Tim,
So
I'm
how do you
ahead.
encourage people to advocate for themselves when their GPs, gynecologists don't want to give them more? Because the standard dose of progesterone that people get is usually 100 milligrams
Yeah,
daily.
that
And
works for a few people, but that's a low dose.
right. So um, I don't know. I guess we can talk about it at the end, but as you mentioned, a lot of people who've even had surgical hysterectomies should be on progesterone because it's going to alleviate a lot of symptoms and help them feel better, correct?
And they're going to live longer. They're going to
Yes.
feel better. They're going to live longer. They're going to be healthier. There are many benefits to progesterone.
Great.
So,
So
Tim,
I was
Tim, I'm
I
going
was
to
going
give
to
you.
jump to the man side.
We're going to jump to the man side in
The
one
man.
second.
Okay.
In 1 second.
Let me,
The
while we're
man
still on
side
the
is
women, I
the,
want to
the,
tell
the,
Tim the magic three.
the man side is very easy. So,
Let me tell Tim the magic three.
Go for it.
You say, May, you're right, and I'm wrong, and I'm terribly sorry.
yeah, exactly.
That works every time,
Every
even
time.
if they know that you're making fun of them.
So
Did I
when
say
you
that?
do,
Perfect.
You may have
when
to
you
cut
when
that
you
out. That may
when
not
you
be
do
PC enough.
No, you could leave that in.
when you do topical testosterone in women, you said you use like what did you say, 50 milligrams per cc per
I
ml?
think that it's so expensive. See, they charge by the volume. So if you get 6 milligrams per cc, like May claims she recently got, or whatever it is, 8, and you get 50 milligrams of that, 50 cc's, it costs the same as getting 50. And if you put that in the refrigerator, it's good forever. I mean, it's good for a year, 2 years. Now, you know, for compounders, they're forced to short date those things
Mm-hmm.
by statute, right? And it's part of the way Big Pharma has SCREWED, these compounders. I mean, they're trying to take them out. They have this study that they paid the National Academy of Sciences to promote and do this stupid study that claimed that they were inconsistent dosing and all kinds of problems with compounders. But it's basically an economic competitor, and the compounders are less than 5% of the total pharmacies now. At one point, they were a tremendous number of them. I mean, they were 50 or 100% of them at one point. But now these big pharma people, they're so freaking greedy. They're trying to take this tiny competitor out. So go ahead, Tim. What was your next question?
So if you're on 50 milligrams per mil because it's less expensive and you're putting like the little like half a pea sized amount of testosterone cream on yourself as a woman, is that like once a
Hopefully where
week,
the sun
twice a
don't
week,
shine.
5 times a week?
Did I say that, May? I'm sorry. She's laughing at me, Tim, so she's giving me encouragement.
Yeah.
It's so funny. Tim's like all serious for once.
Yeah. So
Yeah.
so how
We're just trying.
how
to have
often a
good
week
time.
So
is that?
the testosterone lasts longer in women than men for some reason. So every other day is probably fine. And the women can sense it. I mean, they're much better. I mean, I can hardly sense anything. I can't tell, you know, I can't tell the difference between 1 and 2 cc's of testosterone hardly. But the women often can tell exactly where they are, and they need to be brought into the therapeutic equation to help them. I'm going to use the word empower them. empower them to work with you guys when you prescribe, and say, look, within a certain range, experiment with the dose and see what makes you feel the best. But you should use all these different hormones.
Well, you mean actually including the patient into
Yeah.
their
Imagine
therapeutic?
that.
What a novel idea.
No kidding.
It's amazing. But I feel so much better when I'm.
Oh, you can't have that.
You are
When
not
you're
to feel
dictating.
better. You are to do what
The
you're
journals
told.
say you cannot have that.
Yeah,
Yes.
no, it really. I think we're going to have a real renaissance, though, post-COVID, with sort of the absolute decimation of credibility of a lot of these agencies now, where people are going to be more open to go, hey, you know what? I trust my doctor because I've known them for a long time. I know that they're not perfect. They apologize when they get something wrong, blah, blah, blah. Let's just go back and reset this and see what we can do, because, again, we could go on all these bunny trails with regards to other specialties, but this one, especially, as you get into this aging demographic and the absolute staggeringly horrific possibility of essentially spending 100% of what we spend right now just on Alzheimer's disease,
Yeah.
is
Crazy.
harrowing, to say the least.
So I don't want to.
You can prevent Alzheimer's, but you can't treat it with estrogen. There's no good treatment period.
No. Well, there's no, but even the Alzheimer's drugs themselves are essentially worthless. So that's a whole other
right. So I don't want to forget the men, but I know that guys will be wanting to know, do I need testosterone? The answer is probably yes.
Yeah.
And I know we've been doing it wrong in general practice for years. Guy will come in and get his one big shot every month.
Well, no, so this is, let me just, and I know Robert knows this story, but this is exactly what would happen in traditional allopathic medicine. Guy comes in, he's maybe in his 50s, oftentimes 60s or 70s, has absolutely zero horsepower, does not give a crap about anything. Okay. And you go, I'm going to get a testosterone level. You get a testosterone level, it's super low. It's like 100, 150. So he's well within the range of, abnormal for age. Okay. So then we whack him with a gigantic dose of depot testosterone once a month, and his level goes to 250 or 300, which is sort of the lower limit of normal for age. And we're like, you're treated, you should be fine. So he doesn't ever have steady state. He converts a ton of that initial massive spike to estrogen. And he goes, this is BS. It doesn't really do anything. And it's because he's vastly underdosed, never gets to steady state, and no one looks at any other of his hormone levels.
Okay. So I would claim that the concern about high estrogen levels is generally misplaced. I would also question whether we have in America a depot testosterone. The only thing I've ever seen is cypionate and enanthate, and those last 3 to 4 days. In Europe and Britain, there is a depot testosterone, lasts a month, and it can keep the levels up. And I think it's a much better steady state than what we have. But I think you said that you're on twice a week, which is excellent, gives you more steady state levels. But it's not absolutely clear that porpoising or going up and down testosterone level makes any difference as long as you get enough. So that's my initial reaction to all that. I mean, you need testosterone. You very few men care. Look, I've tested a couple of my friends who seem to have had lives where they were the alphas the whole time, and it's my theory is their levels are 1,000 when they're 65, and they're doing very well. But most of us get beaten around or age or something, and our levels are much lower. And mine were, they were less than 200 when I was 45. So I've been on testosterone replacement ever since. The trouble with the cream is it has to be applied twice a day, it has to be rubbed in. It's pretty easy to do, but it's very easy to not do it. And if you get a shot at least once a week, you're going to have the number of milligrams you need. And these idiot guys in their office who are administering testosterone every 2 to 3 weeks, they're not doing their patients any good at all, or at least the good they do is very modest.
Yes. No, that's what I used to do. And it was just silly. And with as inexpensive as the, testosterone cypionate and, cottonseed oil or whatever it is, and the fact that you can dose it subcutaneously, which is super duper easy for people to do, and you can do it 2 or 3 times a week, it's just like, hello.
Okay, so the idea that you should give cypionate or enanthate subcutaneously is a misconception unless you're a woman. And for a woman, 1/10 to 2/10 of a cc of that stuff does not cause a lot of inflammation. But for if you don't put it IM in a man, most of us have bruising, and even if we hold the area, there's sore for a couple of days. So there's absolutely no problem as far as the levels go to give it subcutaneously, but you can train people just as easily to put it in the upper outer quadrant of their butts and rotate, use a 25 gauge um, uh, 5/8 inch or 1 inch needle, and that works perfectly well. It's just not painful.
But as
New
far as
needle every
blood levels and effectiveness, whether it's subcutaneous or IM, really doesn't make any
no
difference.
different. No different.
Yeah, that's what I thought. So tell us about this, because there's a lot not a lot, but there's definitely discussion, especially when you get into like bodybuilder blogs or guys are on ginormous doses of God only knows what. As far as when is an estrogen level in a man too high?
Well, for those guys, I don't know that much about the bodybuilders, but maybe they have a real problem, and they get gynecomastia, and the problem is more a cosmetic problem and a tenderness problem than a physiologic problem. And I mean, estrogen is very helpful in a male too. It suppresses prostate cancer. It's used to treat disseminated prostate cancer, and it works pretty freaking well. And they get doses that are, they give them doses that are, I mean, they're higher than a woman would take for menopause.
I guess I would think when you're getting roid rage and you're infertile, maybe that's a high enough dose.
Well, but the road rage is
universal. Infertility is universal for a man
Yeah,
on
yeah.
testosterone, and it's usually permanent after a few years.
But if you look at the roid rage part, that's like when you get into these, I mean, now we're getting in on a total bunny trail, but when you get into the bodybuilder stuff and, like stenazole and all these are all.
And liver effects.
These are all completely different non-bioidentical
Right.
hormones. And that's why they cause the crazy liver effects. I mean, stenazole, if you could take that, which was the Ben Johnson drug that he took when he was training for the '88 Olympics, if you could take that safely, I mean, that is unbelievable. Like the amount of muscle mass it's like it converts every fat cell in your body into muscle. It's crazy, but it's also super dangerous.
Yeah.
But I mean, it's just
we're
insane.
talking physiologic doses here. Yeah, we're not talking
physiologic doses,
right.
but it's so.
I don't think you ever have to measure estradiol if you're giving physiologic doses in a man. There's no reason to do it. It might be a little high, but you don't worry about that unless you're taking these huge doses. And
Okay.
I think that you're talking more about growth hormone, which maybe is harder to track when you see that. You're looking at mixtures of all that stuff, and I mean, as far as I can tell, growth hormone's freaking harmless. I mean, it's almost totally harmless. In theory, you use too much of it, you get diabetes. But I mean, you get swelling, occasional carpal tunnel, but that's about the end of the side effects. But it's almost unobtainable. It's very expensive.
Growth hormone is prohibitively expensive, really difficult to get. I think the only FDA indication is for congenital short stature or something like that, where you give it to children.
Yeah, you can use it off label.
If you want to go down the growth hormone world in the OTC, is there any benefit of the antler sprays and that kind of stuff, where you take deer antler velvet and crush it into some god awful tea?
I can't address that directly, but my suspicion is it's nonsense. You better get you better get the real stuff, which you can get inside the United States from these compounding pharmacies. And they've got injection systems which make it very easy.
But it's still really expensive, isn't it?
It's still really expensive. You can buy it on the street cheaper.
Wow.
But testosterone typically is more expensive on the street than a prescription. But of course, you do without the doctor if you get it on the street.
Yeah, but the prescription, we are not advocating buying anything on the street, by the way.
No kidding. The look on your face. Are you thinking of doing something I don't know about?
Other than tacos, street tacos. But it is fascinating that growth hormone got this really, really super bad you know.
And the other one I'm thinking of is DHEA, which is in your book too. I mean, that's another one that gets associated with
Okay.
bodybuilding world, and but actually
So
use quite a bit, right?
yeah, DHEA is harmless. There's nobody's throwing any rocks at DHEA either. And the thing about DHEA is the over-the-counter stuff is generally the short-acting kind, which doesn't work very well. I believe you can get long-acting DHEA from lifeextension.com, and I think nutraceuticals.com. I think it's
Yeah, it's
nutrascriptives.com. Nutrascriptives. It's in my book. But you can use very large doses. Nobody's ever overdosed on DHEA. My mentor, Neil Rosier, has experienced using hundreds of milligrams a day on women in their 80s, and they find it really helps their joints, makes them feel great. And they're dancing in chorus lines, geriatric chorus lines in Palm Springs.
sign me up.
But yeah,
Wow.
really. So
I'm
it's
not sure
supposed to
I'll go
be
to that
like a
show.
mild testosterone in a pill. And some men that are afraid of testosterone because they've read all this propaganda, uh, they actually respond to DHEA and they feel better.
Wow. So I'm jumping ahead, but I want to touch on melatonin really briefly because that's one thing that kind of got a huge bad, good rap, then bad rap. And it's kind of like it bounces around and depending who you ask, because um, for a while I was like, this is great. This helps me sleep. And then you read things like you shouldn't use it long term. It's addictive. It can be harmful. It's habit forming. And I forget what all the other bad things proponent with melatonin. So really,
Habit forming.
yeah, you're addicted to going to sleep. I don't know.
I'm also
So
addicted to taking
Mostly, you can't go. Hey, stop! You can't sleep without it, kind of a thing. It's pretty much akin to having to take, I don't know, like Tylenol PM, and you can't fall asleep. But for some people, I mean, it does more than just help them sleep. It has a whole lot of other benefits. So, do you want to jump into that a little bit?
So melatonin is entirely harmless, and you can take doses of 100 milligrams, the long-acting stuff. People do that when they're changing time zones. You fly to Europe and you take that in the morning, or you take that in the evening a couple times, and you frequently can switch altogether. So nobody's throwing any rocks at melatonin that I know of. It's supposed to be an antioxidant, whatever that means, and it has multiple positive effects.
I think some of the
And
people in the sleep medicine world they like to use it short term, but they don't recommend long term because you know how they
they're
focus
trying to
on.
sell all kinds of nonsense.
Yeah, probably.
They're trying to sell sleep studies that cost more than buying a CPAP
Right?
machine. I mean, it's
Yeah.
outrageous. You should be able to buy the CPAP machine over the counter, try it out, and if you like it, keep it.
No,
Yes.
It's
You're preaching to the
I
choir.
used to
yeah.
do utilization review, and that drove me absolutely crazy. Like I literally would say to the utilization nurses, I said, you realize we could buy two CPAP machines for the price
Yeah.
of this one sleep study,
Yeah.
and all you need to diagnose this guy with sleep apnea is a set of eyes. He
Yes.
has no neck, and he's 100 pounds overweight. The chance of him not having sleep apnea is 0.
Okay, on to melatonin.
So the typical this typical dose for women is something like 7 or 8 milligrams at night, and it's a little different with everyone. Some people need to take it an hour or two before they go to sleep, and then some people take it and they just fall over right on the bed and go to sleep. Men need more, perhaps on average of 15 milligrams total. Again, you need the long-acting varieties, and you can see if lifeextension.com will still. But any of these compounding pharmacies, this can be prescribed, and you can send off to Anazao, and they will do the long-acting melatonin. And it comes in any kind of compounded dose you want, typically 1 or 3 milligrams.
And long acting is better than just what you buy immediate
It
release
doesn't seem
because
to have as much effect. I mean, some kids are very sensitive to this stuff. My son takes it occasionally, and he just takes the garbage you buy over the counter, and it just knocks him right out. But
yeah, that's what happens to me. But
yeah.
I'm just saying you recommend the sustained release because it just gives you steady state sort of levels and you don't get the middle of the night wakening. Is that right?
Well, it's 6 hours, and there are many positive effects of melatonin that you may not get if it only lasts an hour.
Such
So,
as?
yeah. Well, I mean, look, I'm not any great scientist about this, but they say it's an antioxidant and it has
Uh-huh.
all these other positive effects.
Right.
Yeah, there was a whole bunch of talk in the COVID world about melatonin as a sort of antiviral treatment too.
Yes.
That whole
That's part of the Mask Plus protocols,
yeah,
actually, melatonin.
melatonin
Because
and,
it actually does have an anti-inflammatory effect, believe it or not, and helps in cell repair. So
yeah, well, we're experimenting. I have some short acting and long acting. Actually, if N is 1 and 1 night, I took a 10 milligram long acting last night, and I was in a coma. It was
It
awesome.
So I
doesn't
was
work for me. And I get funky dreams too. So that's the downside.
that's
Some
the
people,
downside of it, right?
yeah.
I would say for me, which is really kind of a cool phenomenon, is there's a lot of people like myself who have trouble with waking up in the morning. It takes me like Tim nudges me, the alarm clock goes off, I hit the snooze button, I just can literally not drag myself out of bed. And I used to say, I think I have a problem with my adrenal glands, or I have no cortisol or something, because I could never wake up. It took forever. Using melatonin is nuts. Like, it puts me to sleep right away, because
That's
I
great.
also have trouble falling asleep, and then I sleep like a rock. But when I wake up in the morning, I'm like awake in like 10 minutes. I'm like, this is crazy. So I don't know, I'll have to look into that more. I don't know what your thoughts are on that, but it definitely does sort of readjust your sleep wake cycle, and it certainly helps with wake for me. And it might be,
It's
just
just
might
because
be my own bias.
it just because
Study.
as soon as you wake up, you get to spend the day with me, and it gets you so excited.
Maybe you're.
She's young and she's healthy, and I want you to enjoy your time, May. So do you
Oh
want
my
to,
gosh.
just to follow up on this, just do a final section? Can I do a rapid fire on hormone therapy magic?
Yes,
Yes.
let's do it.
Okay,
Magic.
so
We like magic.
so you know about oxytocin? It's like a Viagra for women, and
Yes.
it's okay. So you know that's an interesting thing. It's used to treat delayed ejaculation in men. It's supposed to help bonding and all kinds of other stuff. It's known as the lactation hormone.
I think that's
So
why some women keep nursing their children until they're off to college. I mean, they say it's for the good of the child, but I really think it
they
does
enjoy it.
a lot more for the woman. I mean, yeah, there's that whole milk letdown. I mean, it
Yeah.
is, unless you're a woman. Well, you get the picture. Anyway.
I'm reserving comment.
Multiple orgasms with that
There you
kid.
go. There you go.
So it's available in a proprietary nasal spray, but it can't be patented because it's bioidentical, and so the compounders make a 20 milligram pill that's not too expensive. So, and we know about about Scream Cream. Scream Cream.
Is it like
This is
hot chili
for primary care.
peppers where the sun
No,
doesn't shine? That's what I'm
well,
thinking.
you put this
Somebody's
on a one preparation contains Viagra 3%, nitroglycerin 0.2% in an ointment. You put it on the clitoris 30 minutes before sex.
I'm
And some
screaming
others
just
add
thinking of that.
have an look at her. Look at that expression on her face.
Oh,
Okay. Anyway, all right. You can read about that in the book. So
I think it depends on the applicator used, but that's just me.
Good question. That's a little too spicy.
I can't
probably
put it
for
on.
me.
I don't have any batteries.
Okay, so there's a section about these hormone blockers being used to treat hair loss, but there are some permanent sexuality problems in the men that use them in some cases. So I think I'd be very careful about that. And for excess hair, some women have been treated with metformin, spironolactone, birth control pills, oral estrogen, and spironolactone somehow works pretty well for healthy hair
it
growth.
does. It
So
does.
treating cancer with hormones, we spoke about estrogen treating disseminated prostate cancer, but I don't know whether you guys know that testosterone avidly suppresses breast cancer, and it can stop it in its tracks. You need levels that are 2/3 what a male level would be. You got to get those women up to 650, 700, maybe even higher if they're in trouble. And there's literature about this. Rebecca Glazier, who is in Ohio, she discussed her experience using implantable testosterone pellets, and she combined that with a blocker drug. And I've got another friend that did this too and referenced it in his book. And so, what else here?
Interesting.
Breast cancer survivors. 4 years after breast cancer, the hormones should be started. It increased their lifespan. So hormones can theoretically replace Prozac, Xanax, or even Zyprexa, which is an atypical antipsychotic for depression, but it's hard to switch them. I mean, it really is nasty. Polycystic ovarian syndrome, the main two treatments are thyroid and progesterone. And you can try those on your people that you think have PCOS and see if they do, if they help, and bump the thyroid and the progesterone up. I mean, you don't want to be afraid of a low TSH. You want to push it so the TSH goes to zero, and you don't want them to have cardiac symptoms, but it can be very helpful, and these people will hug you and kiss you, and they'll have kids, you know. Hormones promote weight loss. Thyroid, estrogen, growth hormone, testosterone, DHEA all promote weight loss. They reduce the bad visceral fat around the abdominal organs, and testosterone is the best weight loss drug we've ever had. Estrogens, but still having pain during sex, right? So oral estradiol may not entirely protect the vagina, but there's troches with compounded estradiol and DHEA with doses that I suggest that will do the trick. And you're going to think this is a hassle to put this in your coochie, but it's easy. It's a little tiny thing.
Again, it all depends on the applicator.
Oh gosh.
Really? Who is doing the application? Right. Yeah, true. Okay, so
you're eye rolling at me.
May, did you look at my QR codes in my book?
No, because I have the audiobook right now, so I need to get the written form so then I can scan the QR
ebook
codes.
has the QR codes too. So
oh
you
yeah.
take your camera, you put it up on your computer, and you take your camera and you can see testimonials and all kinds of stuff. It's very good. It shows how the technique is to put in the belly button testosterone pellet, all this stuff. So chronic fatigue syndrome, it can be treated with hormones, and it works pretty well. It's not
I found that fascinating, that part, that chapter in your book where you talked about that, using the hormones for chronic fatigue and how some people, dramatically improved. I mean, it's not 100% cure, but their life was like taken back. Yeah, that's amazing.
Bump the free T3s. Bump the free T3s up to 5.5 or higher. That's one. You know, the top of it's supposed to be 4.5 or something like that. But use that free T3. Ignore the TSH. It's a completely useless test. It's the reverse of what anything is rational to use that thing. But if you do like the TSH, get it down below. Get it down to 0.5 or 0.25 or lower. Osteoporosis is successfully treated with growth hormone and testosterone. And these bisphosphonates are a horrible disaster. I hope you understand that. There's also something called iproflavone, which is over the counter here. And you can bump their vitamin D to the upper limits of normal, along with vitamin K, progesterone, DHEA, selenium, estrogen.
Yeah. Yeah. I wish we had time to get in a little bit more into the thyroid part of things, but that's been a big controversy as well, as far as people, especially I think more naturopaths, are willing to treat people that have thyroid symptoms, but they're still fitting in the bell curve of the lab data on what their thyroid is. And
I think the most interesting thyroid study I'd ever heard of, I was talking to one of my psychiatry colleagues at one point, and they were, I think it was in Scandinavia, they were treating people with bipolar disorder with gigantic doses.
Depression. Yeah. It's standard therapy for psychiatrists in depression. They get their TSHs pushed down to zero, and their labs are just off the chart, and nobody ever dies. Nobody ever gets atrial fibrillation. None of that nonsense. The endocrinologists are scaredy cats because they treat Graves' disease. And Graves' disease, you're stuck with very high thyroid levels because the thyroid gets stimulated by those antibodies. And there's no way to turn it off. If you have cardiac symptoms and you're on thyroid, you just freaking stop taking it. It's no problem at all. You're in 12 hours or 2 hours, you're fine. But for Graves' disease, you got to get on that PTU and the freaking, the other drugs. So thyroid, I recommend you read StopTheThyroidInsanity.com in its entirety, and I believe that's it, but I can check to make sure. Let me be sure that's it. And that thing is the best single resource about thyroid disease, and it is more complicated than any of the rest of it.
perfect.
So how did growth hormone become, again, a bunny trail, but how did growth hormone become essentially like heroin as far as how hard it is to get and being scheduled? Was it all because of the growth hormone Olympics back in 1988? Was it what was it? Because that just seems bizarre to me.
What happened with growth hormone was the same thing that happened with testosterone. And there were all these hearings. Well, it's part of the same story. There are all these hearings before Congress about scheduling testosterone, and even the FDA stepped in and they testified that testosterone was almost harmless. But it got scheduled, and it had to do with the politics of all this sports doping and all this other stuff. And I mean, sports doping is universal. There's nothing we can do about it, and demonizing it, I'm not sure what good it does. I mean, we got this guy who's one of the greatest athletes in history named Lance, who, I mean, we've spent $5 million trying to tear him down, and the federal prosecutors didn't put a hand on him. I mean, they settled for $5 million, and they spent an enormous amount of money trying to beat him up. But he's a phenomenal athlete, and he was doing the same thing the French were, and beating them at their own game.
Yeah.
You know,
Well, I
drugs,
think
lying, and
they're all
cycling.
doping.
No, they're all doping.
we're
Yeah,
all
I had
doping. Yeah.
I had a buddy that worked for Nike, and he was going when I was one of the last tours that Lance won, and he was going to be in the chase car at the very end of the race when he crossed the finish line and was orbiting the Champs-Élysées. And I asked him, I said, so do you think that they're doping? And he just starts laughing at me, right? I mean, this guy from inside the industry, he goes, no, they're all doping. He goes, every single person is dirty. Like, you're insane to think anything different. And I was like, oh, sorry, I feel dumb now.
Well,
Yeah.
let
Well,
me
we
help
three
you.
are doping. We three are doping too, right?
That's right.
Absolutely,
dirty, right?
doping for the good. Now,
Yeah.
I guess sort of to close, I'm thinking, what are your thoughts on the new hormone clinics that are popping up, the telehealth hormone clinics? Where would someone go? It's really difficult, which boggles my mind that so many gynecologists who that's their training is in female hormones just don't want to do hormone replacement or say they have no expertise in it. So for the average person looking to find someone that's going to help them with doing the bioidenticals or hormone replacement, any thoughts on did you just have to do your due diligence and hunt it out, find somebody that can prescribe? Can they pound your door down and find you, pull you out of retirement? What are our options?
No, you guys. So the best group is this worldlinkmedical.com, and you can find a doctor in your area with them with the same training as I have.
Ah, perfect.
The second
World
best
Medical.
group, yeah, worldlinkmedical.com. And you guys must attend one of their training sessions. I mean, you absolutely have to do it. I mean, if you're willing to sit down and study my book 3 times over, you don't have to do it, but nobody's going to do that. If you go to one of these meetings, it'll get you very excited about it, and you'll hear all these anecdotes. You get to meet Neil. I mean, it's Salt Lake City, so you just got to fly to Salt Lake.
No, people will be pounding down our door now.
Well, they will be. No,
but
they will be. But
worldlinkmedical.com for patients that are looking
There's another group.
Yes. Okay.
Called American Academy of Anti-Aging Medicine, A4M. But they're heterogeneous. They're not as clear, and they do promote a bunch of stuff, in my opinion, that is useless, like cream progesterone. It just isn't. You don't get high enough levels, and we've checked that. You put the cream on, and then you check your levels at intervals. You get levels for 2 hours, and then if you put it on 4 times a day, it's the same. There's a lot of promoters in this thing, and I talked about all these people in one chapter, and this group that I mentioned previously that Suzanne Summers advertises for, they recommend all creams, mostly creams. Maybe thyroid isn't cream, and they oddly enough, their odd thing is they try to match the male and the female testosterone levels during different parts of the cycle, and they cycle the women, which isn't necessary. It isn't necessary, and it's aggravating for these women over 50. And some of them have a little menstrual period, which, who wants that? Better to take enough
No,
progesterone.
thank
Yeah,
you.
really.
I've done my time. No more. I always said if men were women, well, which is happening now in the real world, that they would have invented a pill you swallow that turns that little sucker into pixie dust and implodes it the second you're done with it, because it's so annoying. So
What little
no,
sucker?
the uterus.
Well,
Oh, the
you've
uterus.
heard
Okay.
Your uterus. You'd swallow a pill and your uterus implodes and it's gone, because that's how guys think, right? Get rid of it because you don't need
you
it.
heard what Dave Landau
But
said
but
about
seriously, no woman wants
if
to have
women,
periods.
if men had babies, you'd be able to get abortions at McDonald's.
That's terrible.
It is really bad.
That's terrible.
It's like, I'll have a Big Mac and suck this little party crasher out of me. What do you mean? I can't drink for a year?
Yeah.
So, yeah,
There you go.
we're not
Yes,
advocating anything.
no,
but
I think in my career, I remember having one woman ever that said, "Oh, I don't care if cycling," because she was cycling on her hormone replacement and then going through menopause. She goes, "It's just easier. I don't mind." I'm like, "Are you kidding me?" But nobody else. Like, I can't think of
This
certain
idea
person.
seems to have come from the gynecologic camp. It's
Yeah,
equally
yeah.
irrational as to the no progesterone necessary. It's crazy.
Right. Well,
if you don't want to be protected for your heart and the other things the hormones do to protect you, have 50% of the month, then you cycle. I mean, if you don't care about your health, cycle.
there you go. If you don't care about your health, it's like, I love it. Well, this has been awesome. I mean,
yeah, no, just
you
fantastic.
guys are, and if you ever get to California, please look me up. Please stay in touch, and I appreciate you guys.
hey,
Absolutely.
we appreciate all your help, and we'll link your book, and I know people will be reading it. I should give a couple free copies away.
I'm envisioning getting pounded with emails for, when are you going to do this? When are you going to do this? When are you going to start this? So you never know. Maybe it will become a sideline of some sort. Who knows?
You should. You're allowed to download that book. Don't send them the download link, but download extra copies, and you can email those to your patients.
Oh, right. Yeah.
They can save the $3 that it costs on Kindle.
Outstanding.
Perfect.
Well, fantastic. Again, maybe someday we'll have a talk about cholesterol, but I don't even want to open that can yet, because I've been researching some of the newer agents and it's driving me nuts. So again, thank you, Dr. Robert Yoho. Always a pleasure. And when we get ever back to California, we'll definitely hang out together.
Right.
Well, that was awesome. I think that there's if I could tie this all together, comes down to a few principles, because as we know, principles are what ultimately matter.
You like to tie things together, don't you?
I do like to tie things together. And I'll leave it at that. So,
okay,
number
my
one,
turn now?
bioidentical hormones. Is that some super secret sauce? No, but they appear, at least from studies, to be a little bit safer. Number two, dose primarily to symptoms. In other words, your symptoms should be getting way better, or else you're not getting enough. And most doctors are too chicken to push the dose of these things. And then number three, combination. You need to get the right combination of secret sauces, especially for women. I think that the progesterone one, if you read in his book, is absolutely fascinating. Like, for some women, it is like the de-anger, de-anxiety, de-stress medication. It's like,
Yeah, I'd say it definitely doesn't
Xanax
get enough.
on steroids without any of the side effects. It's really fascinating.
Yeah.
So progesterone is really, really, really interesting.
I was just going to say, I don't think it gets enough attention, that we put too much focus on estrogen in females, and it's both hormones equally. And
we don't focus enough on estrogen in males. I mean, that's the thing. Like, and it's just like, women don't need testosterone and need these ridiculously low levels. Now, if you're not getting a gigantic Adam's apple and a deep voice, the dose you're on, if it's working, is probably okay. I mean, you don't want to be masculinized with it.
And then I would add, side note, if your husband is on testosterone replacement and you're a woman and you're not, you're going to wish you are soon. Otherwise, it will drive you crazy. So if you want a happy marriage, so that you're equally yoked, I would suggest
acting, or equally stroked, as the case may be. You're asking for a friend. I hear.
I'm asking asking for a friend. And the final thing I would say is definitely check out the link, which I'll put in the show notes, for resources close to you. There's a lot of stuff out there right now with hormone replacement clinics, some better than others. And I have been researching some of them myself, and it's tough because you want to find one that is pretty reputable. So shop around. I mean, just like you would if you were going to have somebody to redo your kitchen or build your house as far as a home builder. I mean, get different opinions, get different prices, get different thoughts. Don't feel ashamed to get different physician or provider, as we're calling them now, inputs.
And don't let your doctor shame you for asking for something to make you feel better that's not a strict pharmaceutical. I mean, I feel like the scales are coming off my eyes where it's like, okay, so you're a 55-year-old woman, you've been through menopause a few years ago, you feel like garbage, your mood is terrible, and you're just depressed, so take Prozac. Okay, so now any like remnant of any sex desire you had is completely gone. You try to stop the stuff and you get the bed spins and feel like dog crap. Worse yet, Zoloft or, Celexa or any of these other SSRIs. And it's just like, I mean, there's hope out there. And we're going to get into some stuff in other podcasts of just practical things like how to modify diet, how to change levels of exercise that work. But if your hormones are in an absolute, complete, and total dumpster fire, it makes everything else, like, there's not enough exercise, there's not enough protein, there's not enough low-fat diet, there's not enough of anything else that's going to make up for the fact if you have zero estrogen, zero testosterone, and you're a woman. Like, sorry, there's no diet to fix that. Like, you need someone that is willing to push doses to appropriate levels of the appropriate medications to make you feel, to quote Shania Twain, like a woman.
All right, everybody. Thanks for being here this week. Check us out on Instagram or Facebook. We have been posting more social media on Instagram lately as we've been guinea pigging our way along life, sharing more of what we've been doing, testing out, and you can check that out there and send us any comments. Thanks for commenting and asking questions, and we hope to see you again next week.
Later.
See you next time.
It's no secret that medicine is a bit uptight. That's why Tim and I created BS Free MD, to mix things up a little and have fun in the process. Besides, we are having these exact same discussions all the time, so we thought we might as well invite everyone to the party. If you really like us, you can get plenty more and maybe see one of Tim's cool tattoos on our Instagram or Facebook pages at BS Free MD. See you next time.
While we try to keep BS Free MD as raw and real as possible, we can't be held responsible for any medical decisions or discussions had as a result of what you've heard on the show. We know, bummer. But the truth is, we really do care about your questions. So feel free to reach out to us by email at doc@bsfreemd.com.